Hello everyone. I know that I am Dr. Hasina Ghani. I know that Covid-19 has disrupted everyone's lives, and we're currently in the first wave of this pandemic. We've put together a group of healthcare workers with heart, and we called ourselves the Tshwane COVID Care Group. And our objectives are to provide your doctors with the most updated information so that they can take the best care of your health. We also want to provide you with trustworthy information. So you know how to take care of yourself, you know how to take care of those that unfortunately develop COVID-19, and how those that take care of patients at home can also take care of their health. We also have a third objective in our group, and that's more of a humanitarian objective, to take care of the underprivileged in Laudium and surrounds. I'm going to now hand over to Dr. Sujata.
My name is Dr. Sujata Garaj, and I'd like to start off with just saying a few words about what our Minister Zwelin Mkhize has said to us, our Minister of Health. And he said to us that we've passed the first wave of COVID-19 in Gauteng. And what does that mean? It means that it's not over. It means that there may be a second wave coming. The putting together of this video for you to watch is to make sure that we don't get affected by the second wave of COVID-19. So we have guidelines that we've put together with for home care use of, just tell you more about what we need to do with COVID-19 when we're at home. So if we test positive, what are the symptoms, how we can get access to health, how we can look after ourselves at home. The pamphlet will also give more information about your emergency numbers. It can give you about how you can monitor your blood gas levels at home, and much more information. The other projects that we are also undergoing at present are where you can get your oxygen, where you can get multivitamins, what are the media updates on COVID-19 that we can inform you, the public, about. I'm going to hand over to Dr. Abubakar now, and Dr. Abubakar is our senior doctor with us, and he's going to tell us a few words about the underprivileged and COVID-19.
I am Dr. Siddharth Abubakar. The committee we have formed is called the Tshwane COVID Care Committee. One of our objectives is to provide multivitamins, paracetamol for the underprivileged. The underprivileged can obtain their multivitamins and minerals from their doctor via prescription, and their prescription can be changed at a pharmacist free of charge. But they have to go with a prescription from their doctor in order to obtain them. I will now hand over to
Do you want me to get digital?
My name is Raj Kolapin, and I'm going to tell you about how you would be able to access aid in terms of COVID-19. First of all, for people living in and around Laudium, we have a number of healthcare facilities that can help you. The Laudium Community Center, situated in Bengal Street, is a very popular hospital. You'd be able to get a tremendous amount of help and guidance from them. There is a clinic in Laudium, in the central part of Laudium, directly opposite the First National Bank, situated in the premises of the City Council. But then also you have a number of pharmacies in Laudium, as well as general practitioners. Now, it is far more important to get authentic advice from professional people than to ask your neighbor or to ask somebody who had COVID. What we're finding is there is a certain complacency about COVID care itself, and I see a lot of sanitizing fatigue. People are becoming lax about washing their hands, wearing their masks, and so on. So, if we want to fight this illness, we need to still know how this illness presents. For my practice, I still see many people or many patients telling me, "Doctor, I have ordinary flu, I don't have COVID." Ordinary flu is indistinguishable from COVID. The normal chills, just feeling out of sorts, backache, all can still be COVID. So just to reiterate some of the most important symptoms of COVID, you have fever, loss of smell and taste, muscle pain, backache, headache, and a very, very important symptom that we see in Laudium is abdominal pain with vomiting and diarrhea. So please do not sit at home with these symptoms. You are welcome to call 082 911 if you're in an emergency, but call on any of the general practitioners in Laudium, any of the healthcare providers that were mentioned before, the pharmacists and so on, in order to access the right kind of help that you would need. I would now hand you over to Dr. Bawa, who would speak to you about the attitude we need in order to fight this illness.
They say during times of adversity, people need to bond together. And what better way to bond than in the times that we have now? Yes, COVID is a reality. COVID is not a dream. COVID has hit our shores, and unfortunately, it has hit it hard. Laudium has been a hotspot for quite a while now, and I think a lot of us still don't realize the reality of the situation. We're throwing parties and functions. We are attending funerals with more than 50 people. We are getting very close to each other. We have forgotten about our basic rules, social distancing, masking up. Yes, it does work, trust me. So what do we do in a situation like this? We have the opportunity to look after our fellow men. If you do not want to wear your mask, that is up to you. But please think of your neighbor, your friend, your family member. It's time to be fair to mankind. It's time to be fair to the old man and old lady who live down the road from you. It's time to be fair to every single person around you. I think we have come to that point right now where we need to realize it's not about us, it's about all of us. And I think we can benefit mankind, we can benefit our community, and I think if we can do this, we can stand up. The fight for COVID is going to be a long fight, but together we will win this.
60 years old.
Okay. The elderly are our main concern. Please, if you have anybody who are your family members of you above the age of 60, and yes, there are functions which you guys should not be having, and you guys still are, that we need to avoid. Please think of the elderly. Try and avoid bringing them through. Try and care for them. If they need anything, contact them. Keep constant contact with your neighbor, with your family, with your friends, those that you know that are elderly, because we need to take care of the wisest amongst us. We need to take care of the golden people amongst us. So please, please, I implore you, I ask you, I beg of you, take care of the elderly. Do not invite them for functions. Do not allow them to go to funerals. Please make sure that they wear their masks. And if you are around them, please make sure that you are taking care of them by wearing your mask, by sanitizing, by keeping social distancing. Let's take care of our community. Let's take care of our elderly. The time is now.
I am Dr. Siddharth Abubekar once more. I would like to inform you people that it's the Shwane COVID Care Group. Our biggest motto is that whatever you make important becomes important. So to us, we're not going to place too much importance on COVID because we're going to make it very important. Being alive, being healthy, keeping our old people healthy is much more important than